Amanda, and I'm the volunteer manager. And we're joined this evening by a plethora of people from the Christmas team. We'll just do the housekeeping. So we are going to record the session. So if you want to go now, that would be great. If you don't want to be on the recording, you can turn your camera off. That's fine. We won't be offended. Pop any questions in the chat as we go along. We'll type in if we can answer them. Anything we've missed, we will come to at the end. If you could keep yourselves on mute, because there's quite a lot of you in the call, and the background noise can get a bit distracting. We'll aim to finish around 7, and then we'll close this link and we'll send you off to your shift team breakouts in the other link, which have gone to your personal emails. So have a wee check in there. Next slide, please. So we've got a packed agenda. Really delighted to have Jasmine join us after a very busy day that she's had. And then I think we've got someone from the stories team on the call as well. I'm just scanning down the list, but we'll come to that. Then we've got Des from Drug and Alcohol Harm Minimisation and Dom from Homeless Health Service. And then we'll be going through the staff team on services, activities, ops, laundry, all the usual things. So without further ado, Jasmine, I'll hand over to you.
Great, thank you so much. And thank you guys for having me. I'm really happy to be here. I'm actually also in the warehouse, but not in a cupboard, so I don't know why Amanda's been forced into one, but there you go. So I'm just here to give a bit of an overview of homelessness. I'm going to focus on London, but if anyone would like to kind of talk about more of the national picture, I would be happy to do that too. I think a lot of what I'm going to say is not going to be a surprise to any of you as you're all working on the ground and seeing these things firsthand. But I guess just to kind of bring the focus in when we kind of zoom out and look at the numbers on this, we are really seeing a huge amount of homelessness across London. So one of the most robust data collections we have on homelessness is in London. It's the best nationally, and it says at the last count there were more than 4,000 kind of 500 people sleeping rough across London. I think that the actual number is 4,780. So an absolutely huge amount of people, and that is people kind of go like what would be termed as kind of living on the streets. I don't love that term at all, but that's what it's recorded in the data. But essentially people who are long-term sleeping rough, but also people who are going in and out of hostels and other types of provision. So it gives you quite an accurate picture across London, and that is a figure for across 3 months of the year. When we compare kind of the statistics where they are now to last year, there's been a 27% increase overall in the number of people sleeping rough in the capital. So, I mean, it's just really kind of not where we want to be at all. And we know in a policy sense, we're seeing more people, for example, who have been kind of accepted as refugees from abroad who were being evicted at very short notice, and that really increased the number of people sleeping rough and becoming homeless and needing help and support. There are some recent changes that government have made to actually focus in on that and support people so they have more time to actually get kind of access to the help they need to be able to move into work or claim benefits or rent privately, get on with the kind of lives we all want to lead. So that's been really positive, and we're hoping that will have a big impact. But over the past year, that has contributed a lot to the numbers of people sleeping rough. We're also continuing to see in the numbers lots of people coming from state institutions, so leaving prisons, leaving hospitals, as well as home office accommodation, as I mentioned. So another thing that we'd really like to focus on and try to kind of bring attention to, because if someone is in touch and being supported in an institution, there's absolutely no reason that they should then leave that into homelessness. So nationally, there's quite a few things happening at the moment, and also at a local level in London. So the Mayor Sadiq Khan has committed to ending rough sleeping, and his team are pulling together kind of like a strategy on that, which we have been trying to contribute to, and kind of really put forward our experiences at crisis at Christmas, and the people we're supporting. Obviously, the mayor and the GLA are involved in that, as you all know, but really showcasing what's possible when you get people the right support. And then kind of also access to year-round support as well. So there is a focus on rough sleeping in London, and there is more policy focus on that, which we think is really positive because there's more kind of thinking about what do we need to actually support people into homes. And then nationally, the Deputy Prime Minister, Angela Rayner, is chairing a group of ministers who are looking at a national homelessness strategy and what we need to be doing to actually tackle homelessness at a bigger level. And we really welcome that. That's beyond rough sleeping. So they are including rough sleeping in that, but they're also looking at kind of families in temporary accommodation or people in other forms of homelessness. And we are really pleased that that is something that is a priority for government and being looked at, because we know we need to look at everything together. We can't just kind of focus on one narrow issue or kind of only help people in certain circumstances and not in others. So we're really hoping this strategy will lift and be like lift the ambitions and deliver something um, positive over the next kind of year so that we can really start getting people the support they need long term, and crucially getting people into homes of their own with the support they need. So um we're working towards that, and we're looking at kind of the ways we do that in terms of our influencing. Hopefully we'll be looking at campaigns next year, so hopefully we'll be reaching out to lots of you with activities you can get involved with in a campaigning sense. But at the moment, we're just doing kind of policy development and really working with our services and Crisis at Christmas to try to bring through the frontline experience and what people are seeing on the ground into that kind of policy discussion, and making sure national government and the London Mayor are really understanding the key issues. So that's kind of it from my summary. I am really happy for any questions or any kind of discussion if that would be useful.
A couple of questions. So Jenny Kagan has asked, has Sadiq Khan put any timescale on the ambition to tackle rough sleeping in London?
Yeah, that is a really good question. I think he has said 2027, but I'm actually going to double check that because we've had a number of targets on rough sleeping, not from Sadiq Khan, but previous governments nationally. Yes, it is 2027. So yeah, so I think he said he would be working towards that for 2027. But we'll see.
And
And
then, yeah, I think we have a couple of comments. A previous mayor said rough sleeping in London would be gone by 2017, and one before that said it would be gone by the Olympics in 2012. So those are just a couple of comments in the chat.
yeah, and that's very fair. I think there's a few differences, which is one we're hoping to make a difference. I think one thing is actually in what we can see at the moment in how the kind of focus on rough sleeping in London is being taken. It's quite different to before. So they're looking at it more strategically. So they're looking more long term. And previous approaches were very much focused on funding pots, so giving funding usually at crisis intervention point, so when people were already at risk of rough sleeping or already sleeping rough. um, and so really you're only ever helping people in that kind of crisis moment, whereas now the thinking from the mayor's team is shifting a little bit, so that it is longer term, and they're really thinking about how housing works. The other thing is this isn't just the London mayor doing this in isolation. There will be a national homelessness strategy, and they are from the same government. So we have a Labour government and a Labour mayor. So we're hoping that can also facilitate a much more long term approach to this that gets into the issues and thinks about what people I actually need long term to support this. I saw from Dominic, actually, you said the date is 2030, so I think you're right. Sorry. It has been a really long day, so I'm really sorry. But yeah, I guess the rough sleeping commitment is until 2030. But yeah, I do appreciate those comments, and we do see these political commitments that aren't always met, but uh, it's a good, like, at least we have some accountability, and we're seeing work is underway to try to shift an approach and try something new. So we feel positive about it compared to previous approaches.
Thank you.
Oh, great. Thanks, Jasmine. We'll let you get off home because you've had a super long day. Thank you.
Thanks, everyone, and enjoy the rest of the briefing. Just really quickly, Jenny, I saw your question, but I don't think there is anything other than Streetlink, but I might not be the best person to answer that actually. But yeah, thank you, everyone, and have a really great rest of your session. Bye.
Thanks. Okay, let's go on to the next slide. Okay, comms and guest stories. I think John is here from the stories team. Is that right?
I am. Can you hear me right?
Brilliant. Yes, I can. Over
Good.
to you then.
Thank you so much for inviting the stories team to your briefing. What I want to do is very quickly explain what we're going to be doing and how we'd love for you to help us do it when we work with you guys in the hotel. My name's John Conroy. I'm the Christmas Stories Officer, so kind of in the title, my main job is working over Christmas, but I'll be supported by Elida Kakir and maybe Emma McMahon, but mostly you'll be seeing my mush in your hotel. And we'll also be working the day centres as well. Now, our aim is to meet guests, members and volunteers to do story gathering. And I think in the context of, I've never worked in the hotels before, so you guys can tell me, but I think from what I've heard that the best way to work is for us to use our time in the hotels to establish very sensitively relationships, build relationships we can with the guests, members and volunteers. So that for us, it's important that we can then, it might just be a name and a number, but a lead, if you like, so that we can contact people after Christmas in January in the new year. And now and again, we'll be able to gather a story, but I'm not sure if the context will allow, if the sort of the way people want to be in a hotel, if they want to share a story, if it's too early for them, but some might. There's a very practical reason for story gathering, which I think many of you will be aware, which is fundraising. Every time we have a member's story, it massively increases our fundraising. The stats are brilliant, but when you hear somebody really recounting the reality of homelessness, it changes things for the listener and for that's policymakers or the public. And we are trying to raise money. That's how we pay for hotels. That's how we pay for our services, for our staff. And also it's about educating the public so they understand the reality of homelessness. And still, I'm sure you're very aware, people do not understand and they do reduce it to certain aspects of homelessness and often blame homeless people. So we really want to flip that. And I think telling stories does that very, very well. And I think you guys are going to be critical for us. I don't know how I'm going to operate yet in the hotel, and I'm very much looking forward to hearing your opinions about the best way for me to work with you, to work with the guests and the members and volunteers to start gathering stories and story leads. I've been warned many times that people do not like, having people in their face all the time. So I might plonk myself down somewhere. So the more you know who I am and you could guide people to me, the better. You might know people, guests who you already know because you've chatted to them, really would like to tell their story or have something to say, and you could introduce me to them. And just so you know, there is absolutely zero pressure on anyone we talk to tell their story. It's very much about early days, building a relationship. And just so you know, throughout the entire story gathering process, any person we begin working with can pull the plug and change their mind, and is in full control of the story. The other thing, which we've already bumped into in other story gathering, we do have some red flags. Often people, if we know that they're engaged or have been engaged with criminal activity or they've got a criminal record, we do need to know that. But that's something, if you know, will be good to know. But basically that's it. That's what we're going to be doing. And I think it's important that you know, obviously, who we are, but it would be lovely to hear what you think is the best way for us to operate with you to be able to do the story gathering. That's it at the moment.
Great, John. Do you know what days you're going to be in Hyde Park now?
Yeah, well, Media Day is a sort of separate thing, but we'll be there as well, 23rd, 29th and the 30th. And I'm aware on those days, the 29th and 30th, you've got salon, nail bar, lots of different activities, which will be good, a good chance for us to meet people. Does anybody have any specific, I'm sure many of you people have worked in the hotels before. Do you have any good ideas? If you do, tell us now, but if not, it'd be good to hear on the day of the best ways for us to work.
Oh, I think we've got a hand up. Malika, hi.
Hi, I pronounced my name correctly. Well done. Thank you. I was just going to say I've only been at the Hyde Park Hotel. Obviously, it does feel quite different to, you know, how Crisis used to be before COVID. But from my limited experience, I think that often you kind of get used to those that aren't staying in their room all the time. Lots of people seem to hide out in their room, you know, for various reasons. I get it. I'd want to be in my room all the time. But, you know, normally there's always those people that don't mind hanging around and having a chat, or people that like to play bingo. So I feel like because there's actually less communal areas, well, there is anyway at Hyde Park, if they're not accessing a service, it's quite easy to almost tell who doesn't mind being around people, either because they might, you know, be wanting some type of attention, or because they've got friends and they don't mind lounging around. So I think it's kind of easier to spot, because people won't really hang around otherwise. I think most people are in their room, or they've gone out for the day and they've come back. That's just my experience personally.
So people make it very obvious.
Just by being there, yeah. Literally,
Yeah.
if you're lounging around, you're probably open. In my view, just because of the amount of rooms versus the amount of people hanging out. But I see someone else has their hand up, so perhaps they have another perspective.
Okay, thanks.
Well, George, I think you were next up.
Hi, was just a thought really on. It's great to know when you're coming. That's really helpful. But just a thought really. We know why we have to do the media day so early in the process, in order of getting stuff in before Christmas and other news stories and all the rest of it. But in terms of the longer term storytelling, I'm just flagging that it might be, you might get some really more powerful stories at the end of the 2 weeks at Hyde Park and at the end of the 4 weeks at Aldgate, when actually people have managed to, there's something great about being in the middle of the process, but actually I think the dates you suggested was the 29th, which is the end of week 1. Yeah, so it's just really to flag that to you guys, really, that there might be a different, whatever the word is, thing to mine at the end, later on in the process.
Yeah, that makes, I mean, we're going to spend a lot of time at Aldgate because it's extended, because we're a small team. We're trying to maximize what we can do.
Yeah.
Sort of build, like exactly what you're saying, really. You know, it takes time for people to trust you, to want to talk. And as I say, we're probably not going to do full story gap. We do now and again, but normally what we want to do is get a lot of contacts in. And but you're right. I'll talk to Elida about that if we can. When is the end of your period? When is
a week later than that? So my last night shift finishes on the morning of the 6th. So I think the centre is closing on the 6th. Someone correct me.
Yeah, no, we'll be with the morning shift on the 6th. That's our last one.
Yeah. And just that idea as well, that actually if you talk to someone, if you're there early, if you talk to someone early in the process, they're then quite excited. They will come and find you a week later and say, you know, that meeting that I had, it got me into a thing.
So spread the date. So have an early day.
Maybe.
A couple of days later on.
Maybe.
Yeah. No, that's a good idea. I'll talk to Elida, because I think you're right. People have just come in from all different situations, and they probably just want to rest, eat, keep warm, keep themselves, and then they slowly will open up maybe and start trusting and wanting to talk. Maybe they'll get a bit bored as well, who knows, and they just want to have a good gabble. Yeah, okay, thank you for that, George.
I think Jen had her hand up next, and then Louise, and then we'll probably move on.
Yeah, just to follow up on that, really. 29th is the last day of the first week, so there's a shift change on the 30th. So 29th is quite good because we'll have been with those guests for the week by then. On the 30th, you'll have, there will be some overlap, but a lot of the shift will be new on the 30th, so they won't know the guests as well at that point. So if you do want to do 2 days, I would suggest the 29th is useful, and it might be useful for the 30th date to be moved a bit later when week 2 have got a bit more knowledge of the guest and a few more contacts. And if you let us know what times you're coming in, it's always difficult. We find people who want to talk, and then finding people again when you're there who've said they want to talk is always a challenge. So the more information you can give us, if you can give us a time you're going to come in, we can set up a little area. We can have people primed to come and chat to you on that day. That'll help you to get those stories.
We've got 10. I've got written down on my sheet 10 to 11 arrival. Is that a good time to start?
Yeah, because you get lunchtime. Yeah, it is
cool.
Good.
Okay, and then
we'll set you up a little stall somewhere so we can send people to you.
Lovely. And do you think that's the easiest way, rather than me meandering? I don't know the geography of the place, so.
The ground floor is pretty. I mean, it's one area, and if we find you a corner somewhere where all the team know where you are, then if anybody's expressed an interest in coming to talk to you, we can send them in your direction.
Okay, just to say we are looking for volunteer stories as well, so you know that.
Oh.
Okay.
Okay.
Okay, I'm going to say last question for John. Louise, you've had your hand up for quite a while.
Amazing. Hi guys. Hi John. So I would probably recommend, of all things, bringing like a pack of cigarettes, getting involved with them. You know, if the guests want to go and play football, you can go and join them and play football as well, sort of building up that rapport instead of just diving in with knowing their story. I think especially for a lot of our clients that are, you know, from an addiction background, people just want their story. They take it and they run with it from a trauma point of view as well. So actually just being open to the fact that, you know, maybe let's get to know them, get to know their background first, and see if you think, like, judge your audience. Is it something you think they might be interested in, you know, going forth with? If it's not, it's not. Afternoons and evenings are better, in my experience, at Hyde Park, just because everyone's in their room in the morning. They're not used to sleeping at night. So finally it's warm, finally it's dark. They're not going to be up at 10 o'clock in the morning. Like, it's dead. So your better chance is going to be around evenings and dinner time. And actually, you would be in a good position to. I've run the dinner service at Hyde Park for quite a while, but if you turned up and actually volunteered, you know, like checking them in, oh, are you John, you know, and then actually that John might want someone to sit with him and have a dinner. You might notice him on his own. Maybe you could sit with him and over a meal talk about it.
Yeah, it's really good ideas. Thank you. I think I'll report back tomorrow about timings, because if it's much more productive, being blunt, then it's better to come in later if people are going to be more recipient or receptive rather to someone and taking part. I agree. Yeah, thank you guys. These are really good suggestions.
Yeah, brilliant. We've sparked a debate, haven't we? Which is good. John, let's kind of catch up tomorrow, and then I can
okay, I'll leave you guys.
Yeah,
thanks
you so for
much.
joining us.
Thank you. Bye-bye.
Okay, who's up next on our revolving agenda? Okay, Des, are you there?
I am here. Can you hear me?
Yes,
Hello?
we can hear you.
Fantastic. Brilliant. It's just that I'm still at work, so I'm in Chinatown and the buskers come out after 5 o'clock. So it gets a little bit loud around here and they're not very good. So that's hence me having to put my earphones on. Anyway, very quickly, because I know that you're running over a bit, I'm Des. I work for Turning Point. We have 3 services based in the West London area. Our service, which is based in Westminster. We also have a service based in Kensington and Chelsea and one in Hammersmith and Fulham. Turning Point also has a service in Hackney and City, but I think they'll be dealing more with the east side of the crisis services. We will be based at the hotel from Sunday the 29th right through till Sunday the 5th, with the exception of Wednesday the 1st of January. There will be 2 of us coming in at 10 o'clock, and we're going to be there until 4, maybe a bit later, depending on how many clients we're going to be able to see and who has been recommended to us. So can I ask, because we did Chorus last year, and we've had sort of 10 years of doing the gate, and the gate is very different to the hotels. So I have to admit, I was a little bit surprised when I turned up at the hotel and saw how different it was. It'd be nice if we had a little bit of a list of people that you guys might want us to speak to target. We can offer harm reduction support. We will be bringing in lots of naloxone, as well as information for service users and for any volunteers that may need it. Yep. With regards to things like prescribing, we will not be doing any benzodiazepines at all, but we may be able to offer methadone if we can get a little bit of background of the person. What we don't want to do and be very fearful of is prescribing or double prescribing someone, because it is a controlled substance. We have a lot of experience. Most of my team, most of our staff are based in the hostels and the day centres in Westminster and Kensington and Chelsea. So we may have an idea, we may already know some of the people that are going to be attending the hotel. We will be happy to speak to anyone. Detox and rehab, again, we'll see what we can do, but there is a very long-winded process, and what we will not do is if we know that, so if someone tells us that they're already in treatment with another service, we won't be encroaching on that, because if we start to make any changes, it could upset any work that's already being done, and it could actually put the person behind in their treatment, in their recovery program, than trying to speed them up while they're with you at crisis. Yeah, so it'll be great if when we come in at 10 o'clock, we have at least a few people that you want us to have a look for. As I said, my staff, myself, we are very experienced with working with people who are street homeless, especially those that are entrenched and have been homeless for a very long time. I've got 30 years of experience of doing that, 10 years of crisis before COVID. So it was nice to come back last year. Any questions? Emma.
Sorry,
Emma. There you go.
Work out how to turn that off. Des, first of all, can I just say that you guys are just incredible. After all the years of doing crisis, the recommendations that we put through to you, honestly, you guys, you give me goosebumps every time I think of you. Couple of questions, Des, is you guys have got a support phone number.
Yes.
You're not due to come in to us until the 29th and week 1. So there's always that kind of desperate time of how can I keep them engaged. So my first question is that number going to be open over the Christmas period?
It will be. It will be
Okay.
from day one. I mean, we are going to be, again, because of staffing situations and, over the Christmas time, we are going to be at the day centre for the first week. Yes.
Okay.
So again, we may pick up or meet people at the day centre that's going to follow us, or may get referred into the hotel on a later date. But yes, that number is going to be there. Yes, and it's open. Just give us a call. We do have an out of hours number as well. So give us a call and someone will definitely get back to you.
My second question, Des, is by any chance are we going to have your information on like leaflets or pamphlets so that we can give them something tangible to
that's all
mull
coming.
over?
That's all coming. Yes, so I'll have that. I'll bring those all those in. We're going to be at the day centre from the 24th, so from Tuesday. If we brought all that stuff to the day centre, actually no, because we've got a client, we've got a worker in the London hotel, which is just a road down from you. I'll get the worker from the London hotel to bring all that information in on the 23rd.
Des, if the worst comes to the worst,
yes,
get my contact details off Amanda. I'm more than happy to come to your offices and pick them up.
Okay,
so
no
that
problem.
We've got them right from the beginning. You guys are amazing, Des. Lots of respect.
See you soon.
Thank you.
Well, thanks, Emma. I will connect Des with your email. Any more questions for Des? We're really happy to have you on board. Thank you.
Brilliant. Cool. Okay. Well, I will let you guys to get on with it. And yeah, see you in a few weeks' time, if not before.
Right. Thanks ever so much.
See you later.
Have a good one.
And you.
Okay. Who's up next? Westminster Homeless Health Team.
Hi. Hi. And it's no longer just the Westminster Homeless Health Team. We're just now the Homeless Health Team. Hi, I'm Dom. I'm one of the lead nurses for the Homeless Health Team. We actually now cover 7 boroughs of London. So we cover the inner tri-borough, so Westminster, RBKC, Hammersmith and Fulham, Brent, Ealing, Wandsworth and Richmond. So we've grown quite massively over the last few years. This is our 3rd year of coming into support crisis. And the first 2 years we kind of did only a few clinics, whereas this time round we are doing all the clinics at Chorus bar the 3 bank holidays. Each clinic will have 2 nurses. I just kind of wanted to talk very briefly about why health is really important. You may already all know this. The average age of death for someone experiencing homelessness for a man is 45.4 years, and for a woman is currently 43.2 years. The reason for that, there's many reasons why the age is much lower, but we are here as a service to try and improve people's health overall. The majority of reasons why people don't seek help when they are rough sleeping is usually because they've got other priorities, like trying to keep themselves safe, trying to find somewhere to eat, trying to keep warm. Health becomes the least thing until it becomes a problem and they need emergency care. What we try and do is kind of that we will deal with acute problems, but we try and do that preventative healthcare and that long-term health kind of condition management. Obviously, I'm very aware there's a lot of mistrust of health services in general through previous experiences. I've worked in this role for 8.5 years. We are very well versed in the population who are coming into the Chorus Hotel. We know that it can take a much slower approach, and we will just work with the person. So even if they may not see their health as a priority, but you as a worker is going, God, something doesn't feel right, get them to, either us to come and speak with them in the main area, somewhere that's not, in a room, or, get them to come and see us. So we will do a multitude of things. So we'll do kind of general health checks on people. Even if it's just someone wants their blood pressure done, we will do it because often that's the first link back into their health. We will be bringing COVID and flu vaccinations with us for those who want it. I know that Find and Treat will also bring vaccines on 2 days, so we'll let them do it on those days. We will do wound dressings, blood tests. We will also give drug and alcohol advice, and again, try and get people linked back in with this correct drug and alcohol service. So if you've got someone that you know, are worried about that says they're not linked with any service, obviously we've got Turning Point, but if they're not ready to talk to them, they just want to talk to somebody else, we'll be there to have a chat with them. We will do minor injury, minor illness treatment, long-term condition management, especially over the Christmas period where GPs are sometimes closed. We will try and support people. So the majority of our nurses are independent prescribers. So as long as we can find records, we can prescribe. So for diabetes, for example, we can prescribe their insulins. We can prescribe, you know, for that small period whilst their GPs are closed. We will support with GP registrations and kind of the wider health access to get people in. Last year, we saw, I think it was 58 clients at Chorus for a variety of reasons. Lots of prescribing, lots of blood tests, getting people linked back in who have been lost to follow-up through previous tests. And getting people to see their GP, and actually a lot of the GPs were quite receptive and saw people for us on the same day. That's kind of us in a nutshell, kind of what we do. We will hopefully have someone each day from the crisis team kind of supporting us with getting a list together. But if that's not available or whatever, you'll see one of the nurses. We will all be in uniform, kind of wandering around. I often will come and sit outside and have coffee and just kind of be accessible to people because they may just want to come and have a chat and realise that we're not horrible NHS nurses, and we actually do care. And we're not there to judge or criticise. We're there to support them through their journey. Yeah, any questions? I think, is it Jenna?
Hi, yeah. So I've done crisis for a while, but this is the first time I've done Hyde Park.
Okay.
Do you guys cover mental health services?
So we're not a mental health team, but we will. So we kind of will look at the trimorbidity of somebody, of anyone that comes in. So we'll look at physical health, substance use, and mental health. It's not our bread and butter necessarily, because that's not, we're all trained physical health nurses, but we will support, we will safety net, we will get people back in with the right mental health service. So we'll do as much as we can with someone. We try and make ourselves a one-stop shop to try and get people then linked with everybody else.
Yeah. I think my main concern with crisis over the years, and it's been a traditional battle because it's a bit of a busman's holiday for people, but that initial safety net, that crisis time, that linking in with people has traditionally been missing, but obviously you guys will have those links, so that's really helpful. Thank you.
Yeah, that's all right. Emma?
Hi, Dan.
Hey.
You mentioned something and I found it actually really, really interesting.
You
mentioned
what did I say?
You said that there was a mistrust with the healthcare providers, and that's something I've not been conscious of before. So can you give us a little bit more of an understanding of where that's kind of come from, and any tips that you've got of how we can help alleviate some of that and get people in front of you?
Yeah. So I think a lot of the reasons that there are mistrust of services, it's sometimes to do with people's adverse childhood experiences. So people in power, so people holding kind of all of the cards and they're not having any power. But especially around health, people will try and access healthcare, whether that's through a GP, whether that's A&E. And there's that stigma around homelessness. So they are just another drug addict, just another alcoholic. But no one's actually seeing them as a whole person and understanding the complexities as to why they're in the situation they're in. And, people turn up to appointments, the waiting rooms are busy, they might have to wait. And, I'm very aware that our population have competing priorities. They might need to go and use substances. They might need to go and have a drink whilst they're waiting for an appointment. They then become maybe intoxicated, or they might smell. they're then told they can't be seen, or they have to go and come back, so there's kind of those little bits that unfortunately the kind of the structure of health services isn't very flexible, which is where our service, why we exist, because we are as flexible as somebody wants us to be. We don't have kind of appointment time, so if somebody needs, this is why we always will have 2 nurses, because sometimes patients might need an hour with us, they might need 2 hours. We then have another nurse who can do I would say the quicker consultations, because we know that suddenly, as a healthcare professional who's in a uniform and represents the NHS, I'm listening, and I may not fully understand exactly, what's happened, but I can at least be there to listen and take it on board. And I think for us, it's then being able to explain to other healthcare professionals who work in mainstream services what the issues are, and actually they need to take a little bit more time with those individuals. We are big advocates in, we will support people and go to their appointments with them if needed, to be that health advocate for them. If we're concerned that someone might have had a traumatic brain injury, for example, we will say that to the healthcare professional we're referring on to, so that they are aware of kind of why somebody might act in a certain way, or in a behaviour that we don't necessarily agree with, but that's the way they regulate their behaviours. So we will try as much as we can. So homelessness is our bread and butter. That's all we do. We do from rough sleeping up to supported accommodation. I say I've been here 8.5 years. My manager's been here 12. We are very well versed in it, and I think if you're kind of going to try and sell us to anybody, it's like, this is all they do. They don't do anything else. Does that help?
That's amazing. Thank you.
That's
and
all
rock
right.
on the NHS.
Thanks. And one more hand, Louise.
Hi, love. I'm just wondering what time that you guys are there. And
Yes.
sorry.
I forgot to say. So last year we did 10 till 3, mainly to give ourselves the 3 o'clock was a kind of a cut-off, so that we had time to complete all of our clinical records. Obviously, with 2 nurses, we might stay a bit longer. It will just depend on the types of consultations we're doing, how many people want to see us. If there is a long list of people, for example, who want to see us, we might triage them and say, look, can I put you down for first on the list tomorrow morning when the next nurse is here? So the nurses will kind of try and manage that.
Perfect. Also, we have first aid kits, but
Yes.
they're stocked with like our basic first aid things. Do you guys have a selection of dressings that we could have in the office? I'm a nurse as well. And I find personally that they tend to come out more in the evenings, and they'll say, could you just look at this for me? And it's like, yeah, we can get you seen tomorrow. But in the meantime, is there something more that we could put on something until the following day, if you see what I mean? So a first aid kit.
Yeah, we'll have our clinical boxes that they're going to be delivered on this coming Friday. And then what we can do is we can give you a selection of stuff. So yeah, that's fine.
Amazing, thank you.
That's all right. If no other questions, I will let you guys get on, because I think I've talked for too long.
Oh, do you know, I think that was worth overrunning a little while for, Dom. Thanks ever so much.
Oh no, you're very welcome.
Yeah, no, thank you. Have a nice evening.
Thank you very much. Bye.
Okay.
Hi,
Katie.
Hi, this is me. I mean, I don't know how you follow that like stream of guest speakers, just onto the normal staff team now, I'm afraid. But hello, thanks for giving up your evening. Just going to touch on check-in, because we've tweaked it a little bit again. We're kind of just getting it every year, learning a few things, feeding back, trying to tweak it, get it a little bit more easy, a little bit more client friendly. So the first thing we have done is we've got some new tablets, because the old ones were sticky and annoying and a little bit slow. So hopefully that's really exciting, but I've not seen them yet. So fingers crossed. New IT solution is the headline. Same as usual with the kind of check-in system that runs off CLog. There's info on Wikimus on kind of how to use that. and I can show you a slide in a minute. But basically, you'll have a list of names who are eligible to come into the hotel, and if someone is not on that list of names, they are not coming in. And if someone is presenting and they're not on the list and there's any issues, security can support you with turning them away. And on the first night, there'll be crisis staff around as well. But there'll be a really good reason, like that they're not on that list, and that might be that we've rejected their referral, might be that they have other accommodation available elsewhere, and their outreach worker will be able to make a referral through to us if one hasn't been put through. So do signpost them to StreetLink in that situation as well. So please do try get everyone checked in on C-Log as live as you possibly can. Let's not have notebooks floating around, especially now the tablet's a little bit better, because we've got a beautiful new system that allows us to see vacant rooms in your hotel. So if we can get the clients checked in as live as possible, in the back end, our staff team will be able to see empty rooms at the end of night 1, and we'll be able to send chasers to all the guests who haven't turned up yet. Encourage them to come, and then if they haven't turned up again for another day, we can release those rooms to guests on the waiting list. And then the next thing that I wanted to talk a little bit about, and this has come from feedback from CCMT, who some of you will know, and some guests as well. So that they're the caseworkers on site, and they was talking about how when clients check into other forms of accommodation, say if that's a hostel or an emergency bed space, a night shelter, they don't get to come in without having an induction. And I know that we're super busy and that's not very practical at Crisis at Christmas, but there are some things that I think are getting lost when guests are arriving at the hotel, and information that they aren't told up front, so that it could be quite shocking or just like unuseful for them not to know later. So what we're going to do is the little list on the side is all we're going to ask you to run through with them. We'll print these out, we'll have them on check-in desks. It'll be up to you how you want to do it, so you can run through this information with guests kind of at the desk, or you could have groups of guests checking into their rooms and volunteers kind of chatting them through this on the way there. So we'll find a way to do it. We've got some staff, we've got some guest welfare to support with that as well, to give you extra pairs of hands on that busy first night. But it is actually quite a respectful thing to do, to give these guests a little bit more time when they're arriving, and so that they know this key information. So the closed door is just handy for them to know. Obviously they can come in and out with security, but it's handy for them to know that it won't just be easy open access overnight, and that hasn't changed. But the welfare check system, which I think Jess is going to talk about in a little bit, is something new that we've put in, which is a way of us trying to identify that every guest who's meant to be in the hotel has been seen within a 2-day window. So if guests haven't had a meal, or they haven't seen advice, or they haven't had a welfare check, or any kind of interaction in the hotel, it will be flagged on the system that we haven't seen them, and that's kind of a new thing on C-Log that we can identify. And what that means is the guest welfare team will be going to do a welfare check, knocking on their door, and I think it's important that the guests kind of know this is the case, that we'll probably be opening their room if we don't see them. So just let them know. If they don't want to be bothered, all they need to do is just kind of say something through the door, refuse a meal, just let someone know. So that's the first thing, to kind of let them know at check-in. Obviously point them in the direction of where the food is, where the tea bar is. I'm sure you do that anyway. Give them their welcome pack as well. And we don't have guest handbooks this year, but we've printed off loads of services schedules, because that's kind of the thing that the guests want to know most out of that. They want to know the Wi-Fi code, which will be printed off big, and they want to know what's on and when they can see certain services. So hand them that. Anything they ask about, you can show them where that is. Next thing on the list, really important, we do need to run through house rules with guests when they arrive. We have big posters with these on, but last year, sadly, we had to evict quite a lot of guests, mostly at the other hotels, to be fair, but because they were smoking in their rooms. And this is obviously on the house rules, and it is just one of those things that feels like it's unavoidable with crisis guests sometimes, but it is actually illegal to smoke indoors in England, and we do have contracts with the hotels that have stated that there will we will have to evict guests if this is the case. So we really do need to make sure that, like, especially that point on the house rule is made really clear, because it would be such a shame to have to evict a guest or we're in breach of contract with the hotel. So do bring that up. And then before they're shown to their room, there's just a nice moment to maybe ask them if there's anything they want to tell us as well. So I think sometimes it can be quite overwhelming when guests arrive. They might want to say, this is a bit crowded, or don't wake me up early, or, you know, share any triggers that they come, and just kind of asking an open question. They might just say no, that's fine, but it might give someone an opportunity to say something that they want to share with the team. And I'm just going to show you quickly on the next slide. Oh, that's a welcome pack. That's what's in it. You can look at that later. So you see, this is what the check-in tablet looks like. At the bottom, there's this box called Info for Hotel Volunteers. So we will put information that we think you need to know in that at the point of check-in, but you can also add to that, and that will be on CLOG. And the guest welfare team, the advice team, everyone with CLOG will have access to that information. So if a guest is sharing something, that's the place to pop it. Up top, you can see we've also got dietary requirements, which you can ask about. They'll have their phone number there. They might want to update it. And, you know, it will say which language they speak as well, which could be handy if they are struggling to communicate with you in English. Again, we'll have big posters with the translation service, the phone translation service, if there is any kind of in-depth conversation you want to have at that point. But this is kind of just what it looks like. Yeah, I think that's check-in covered. Yeah, so couples. We trialed last year bringing couples into sharing rooms if we thought it was safe to do so, and it seemed to work really well. So every single guest coming to the hotel is risk assessed anyway, and we do risk assess couples as a unit as well. And make a decision when we're told at the point of referral whether we think it's safe for them to share a room or not. If we don't, we will allocate them separate rooms. And if we do, we will put them in the same room so that that other room can go to another person on the waiting list. At Hyde Park, there's some twin rooms as well, and we do actually have quite a lot of kind of buddies or like parent and 18 plus child combinations this year who've asked to share a room in a twin. Hyde Park have really kindly said that they're going to just put the box of twin room keys separately. Like they're just going to pull them all out and give them to you in a box so that you'll have access to those really easily. Just going back to couples, sorry, I'm all over the shop. If we do allocate separate rooms to guests who are in a relationship but we think they need separate spaces, please do honour that. We can't enforce that they use it, but we must honour that it exists. Even if they use it for, you know, half an hour and you never see it and it feels like there's an empty room and it feels really frustrating, because you know that there's someone who might need that space. It is, you know, really, really important for the safety of these guests that there is an option there for it. And I do think that oftentimes it does get used. So we must keep that available to them. Kind of fun little thing on CLOG is that if a couple, like one person in a couple checks in first, when the next person checks in, that room will be pre-populated when they're checking out, which is fun. So you'll know. And we'll also like put that info of who the couples are on CLOG at the check-in tablets, so you'll be able to see it. Next slide, please. Cool. So the waiting list, we send reminders the following morning. So about 12 hours after, it says 12 hours. I mean, I'm not getting up at 6 a.m. to do it, but I will send reminders, you know, 8, 9 a.m. in the morning to all the guests who are on the list who haven't arrived. And then we'll say, can you try and get here for 6 o'clock? If we don't hear anything from them and we don't hear anything from their referrers, we will open up that space to guests on the waiting list for that evening. But if we hear them say, oh, could you hold the room? Or so-and-so's on his way, he's coming at 10 or whatever, we do hold the space. So it's not kind of a brutal wipeout if we hear that they're on their way. It's not a hard deadline, but we do also want to make that opportunity for guests to come in as quickly as possible. Same as normal, you don't need to do anything about this. Your awaiting check-in list will just get updated and it will look exactly the same as before, but you will have a view called no-shows, where you'll be able to see people who have had their kind of room wiped just in case they do show up. And if they do show up, get in touch with us, and we will kind of establish whether there is a room we can give them, but do check in about that. Cool. And then finally, it's the second year we're going to have a women's only floor. We've got 16 rooms on the ground floor of Hyde Park, and one of them is a common room. And India and Jess have worked really hard this year to put some women's only services in there as well. So I think it's at the bottom, there's a special salon and nails, there's a sexual health clinic, breast screening. And we also wanted to kind of give this floor a little bit more TLC. So there will be a designated women's floor volunteer on each shift who kind of is around to check in on the guests who are staying in that area. It's quite often going to be on the guest welfare team, but it might be a key volunteer as well. And we're kind of implementing a slightly earlier time so that the women can walk to dinner together if they want to go in a group and sit a little bit separately from anyone else. They're going to be meeting at like 10 to 6 in the common room area, and they can walk down with a volunteer just a touch early, so it's a little bit less overwhelming for them. So again, these are all new things that we're trying out, but we really do want to kind of put on a better offer for women on that floor. So do kind of feedback to us how it's going. Let us know. Do try and make it work where you can. And yeah, I think that's it for me. Cool.
Fab, I think I'm jumping in here. So we've heard from Dom about the not Westminster homeless health team, just the homeless health team this year. So they're the ones who'll be mainly running the healthcare services at the Chorus Hotel, which is really exciting. And the fact they're doing 7 days is just bonkers and fantastic for the guests. I think we had a question already just about the crisis teams. We are still sending the crisis team, but it's just on one of the days, just because Hyde Park have such a wonderful resource in Dom's team as well. So on Christmas Day, there'll still be the usual crisis lot. So that'll be doctors, nurses, pharmacists, physios, and podiatrists. In addition to this, we're running the eye care clinics at Hyde Park. I know the last couple of years we occasionally sent hotel guests over to day centres. That's not happening this year. You've got your own clinic. So that's running on the 2nd of January and the 3rd of January with the crisis eye care volunteers. This year, one thing that we have that's new is a new referral pathway straight into Moorfields Eye Hospital. In the past, we used to run it in-house ophthalmology, so that's anything to do with like eye disease and conditions. But it meant we couldn't necessarily offer like ongoing support. Whereas this year we have a new referral pathway into Moorfields. That's really exciting. It does mean you might get eye care volunteers sort of telling you about the appointments or asking for like a bit of help arranging transport for guests, so just to be aware of that. It should only ever be 1 or 2 guests. It wouldn't be very many. And then the last thing to mention is that we have the ear care clinics again this year. So that's through our partnership with Specsavers. They'll be in on the 2nd of January, and I believe they're doing sort of general ear health checks and also wax removal. So definitely try and promote that service when you can. Next slide, please. Thanks. And then other than Dom's team, these are the other external healthcare organisations we have coming in. So you've got the Find and Treat team coming in. So they'll bring in their mobile health unit, potentially their like bloodborne virus testing van as well. So I think there'll be 2 vans, but they'll be in on the 24th of December and the 31st of December. They'll be doing vaccinations, chest screening, and yeah, the BBV testing. We've also got Hep C screening coming in. So that's on the 23rd of December, they'll be doing fibro scanning. And then on the 28th of December, it'll just be more general Hep C testing. So try and promote those. I think Katie mentioned them already, but on the women's floor, we'll have the NHS breast screening promotion coming in. So that's a new service we partnered with this year. They're a specific part of the NHS which targets groups that are difficult to engage basically with this, or groups that wouldn't typically be coming to their appointments and following up with screening. They can book guests there and then. So if there's a guest that's within their cohort, they can book them straight into screening. So it's a really good resource. We've also got the sexual health charity SASH coming in again on the 2nd of January. We've got oral health promotion coming in on the 30th of December and 2nd of Jan. They'll just sort of be based in the lobby. And then we have Dentes coming in again. I think I put the wrong date. That should be the 30th of December. So sorry about that, but I'll share it afterwards. So they will be doing cleaning, extractions, signposting and referrals. I think a lot of you might have seen them operating last year. So it'll be the same model this year. They don't do anything cosmetic. So they won't do dentures replacing, root canal, braces, anything like that. Fab, next slide. Right, it's just a bit about meals and catering. So there are the times. I think they're loosely the same as last year. All the meals will be served communally in the dining area. When the guests check in, they'll be asked about dietary requirements. I think you saw that option on C-Log. So things, there's a long list basically they can choose from. So it's vegan, vegetarian, halal, kosher, no pork, and then there's also a free text box for writing any allergens. So once the guests have checked in, that information will be on C-Log, and then someone can kind of run that report for you and get all the dietary requirements off at once. There'll be veggie options available at each meal, and there'll also be the snack bar that's available. And yeah, with the women's floor, I think just to try and sort of push that early meeting time if it's something the guests are interested in. It won't be for everyone, and obviously if one of the guests on the women's floor doesn't want to go in that time slot, they can still go to the dinner later on. But it's just to make it a bit more approachable basically for them if anyone's a bit concerned about the mixed eating environment. And the last thing on this slide is just about meal photos. I heard there were quite a lot of concerns about the quality of the food last year at Hyde Park and one of our other hotels. So this has been discussed with all the hotels. It's been built into contracts. We've had lots of meetings about it. What we would like to do to help monitor the quality of the food and ensure it's consistent across the project is to use a form that's been created to submit a photo of each meal. The hotel have been told this is happening so that there'll be no surprises when you start taking pictures. And I put that shift off as have the form, but anyone can take that picture and do that. I just need to update that. So there'll be a form on Wikimus where anyone on your shift can upload a picture of the meal. It's okay if you forget. It doesn't have to be every meal. It's more important to log any pictures of bad meals rather than good meals. And what I'd say as well, if there's any immediate concerns, then also raise it with ops at the time and they can escalate it to me and I can have a conversation with them. If it's just, oh, I'm not sure about this, I think it's fine, then just submit the photo as is. But if this is completely unacceptable and someone needs to have a conversation straight away, then please also escalate it to ops as well as the form. Great, next slide. Fab, and just a bit about your guest welfare team. So these are your coordinators that are currently signed up on the system. So on each shift, we're aiming to have 1 to 2 guest welfare coordinators and 2 to 3 guest welfare volunteers. It varies a little bit across the 2 weeks, how much availability there is. I'd say particularly in week 2, we're looking a little bit lower. What's really important to say is if there's no guest welfare coordinator on shift, please make sure there's still someone for the guest welfare volunteers to go to. It doesn't necessarily need to be that that person is acting as guest welfare coordinator, but it's just really important they have a designated person they can go to if they've had an upsetting conversation or a difficult conversation or something they need to escalate. Sometimes we've had other shifts in the past where there's been a guest welfare volunteer on their own and they haven't really known who to go to and it might be their first shift. So just making sure there's I don't know if it's a team leader or a key volunteer or someone who can take the guest welfare to one side at the end of the briefing and just say, any problems today, please come to me. So that's really important. And then this year as well, we will also be having Samaritans again. They will be doing 6-hour shifts, so a little bit longer than the usual 4 hours. That's really good. I believe they're in from 3:15 till 9:15. And it should be most days between the 23rd and 1st. There might be a few days Samaritans aren't there, so I'll make sure you're aware of those. And yeah, there'll plenty of resources as well. So even if a Samaritan isn't on shift that day, there'll be plenty of resources that you can be distributing to guests. Great, next slide. Yeah, and then just a couple of slides about the welfare check procedure. I think a lot of you are aware of it already. And all it's really doing is sort of formalizing something that I think a lot of the hotels are doing anyway. But the aim this year is that all guests must be seen every 48 hours. Like I said, I think a lot of you were kind of running similar timeframes in the past anyway. But what's different this year is that we're managing that process through C-Log. So basically, there'll be a really wonderful view on C-Log that flags any guests that haven't been seen within 48 hours. And that's sort of the list of guests that will be prioritised for the guest welfare team on that day. So the interactions that are feeding into C-Log to sort of help with that 48-hour window. And meal logs, which will be logged by the shift office, advice sessions, which will be logged by advice volunteers, and welfare logs and welfare checks that will be logged by guest welfare. So there's 3 different types of things that will be feeding into this. And we've got a really good video that someone will send with you at some point, which is really useful to show how this works in practice. There is also an option on C-Log to mark guests that might need more regular checks. 48 hours might be too long to be checking up on a particular some guests. So it might be at referrals, we're logging any guests that are particularly vulnerable or that we think need more regular check-ins. But also if a guest becomes a bit upset during their time in the hotel, we can also change that at the time. So if something might happen and you're like, oh, someone really needs to check in with that guest each shift or each day, then there's an option on C-Log for that as well. Next slide. Just a bit more about how it works in practice. So the shift office will run a kind of a review on C-Log at the beginning of each shift of all the guests who haven't been seen in the last 48 hours. That will then be passed on to the guest welfare coordinator or the team leader if there isn't a coordinator on shift that day, and they'll instruct the guest welfare team on which guests to do a welfare check. Guest welfare volunteers will then sort of essentially look for the guests in the hotel. So that can involve looking for them in communal areas, sort of hanging around at meal times, and it can also mean knocking on their door and just having that conversation to check if the guest is okay and if they're still using their room, essentially. If a guest is seen, that will then update on C-Log, so they'll just put that in the welfare log. But if a guest cannot be found, that's when they would escalate it to team leaders. And most likely that would then involve a room check with team leaders or security to check on their welfare. The 48 hours is really important for checking on the guest welfare, just to make sure that their well-being and that they've still got access to food if they're not coming down for meals in the last 48 hours, just checking that they're okay, seeing if they need anything. But it's also really useful for us to know if that room is still being used, because it might be that guest has just completely departed the centre, and we can now free up that room for someone else on the waiting list. So serves lots of purposes. I think that's it for me. I'll just go to the next slide. Fab, I'm going to pass on to India. Thank you.
Thanks, Jess. Hi. Yep. So my name's India. I'm back on activities and entertainments this year. I'm just going to run through any changes for this year, really, because I think everyone's fairly familiar. We are trialing 2 shifts for activity organisers this year because in our guest feedback last year, some guests said that they missed kind of entertainments later on in the evening. So we have a morning shift which runs from 10 till 6, and then an afternoon shift, which ties in with the afternoon shift times. I'll just do a sort of call out. We're a bit short of activity organisers from the 27th onwards. So again, like with guest welfare coordinators, if we don't have anyone, it would be great if there was a key volunteer who could kind of just look after the team of activities volunteers. And if they'd be happy to stick on a film and run a session of bingo, then that's all the better. You will be having some art, sports and wellbeing volunteers at Hyde Park every day, and also performer volunteers. They will be coming in and kind of running a performance roughly around 2:30 or around 4:30. We have managed to recruit quite a lot of performers this year, so there will be a performance most days. Next slide, please. Also, for your entertainment, we are in the process of taking out lots and lots of streaming accounts for you. So please do use them. Loads of sports channels, just to kind of highlight, Sky Sports has 12 sports channels, and we're also giving you TNT Sports. So yeah, please do have a look at what's on and stick things on. I'm hoping there will maybe up to 2 different screens at Hyde Park to kind of screen films or sports. And I'll be doing the setup for all of the screens and PA systems on the 22nd. Also new for this year is a little gaming area. We will have PlayStation 4s for you. We are in the process of coming up with a solution to sort of lock them down a little bit, so they will hopefully be less likely to walk away. And again, we'll be providing the PlayStation 4s, controllers and a screen. Just one thing to note is that our IT providers have requested that they are in offline mode, so no internet streaming, please. But all the games have already been set up on them, so they should be ready to go. Another thing is we are doing a Romanian community workshop that will be on Boxing Day, and that is it's open to everybody, but it's particularly targeted at our Roma guests. We've been working with my Romanian community to provide that, and they'll be bringing a mixture of facilitators and musicians, and we'll also be screening a Romanian film. Next slide, please. So salon, you have 4 salon days for Hyde Park, the most of any centre. You have 3 general days, the 23rd, 27th and 29th of December. And then there is a kind of planned women's only day on the 26th. So all of us volunteers for the 26th are women. It's up to kind of you guys whether you want to do that in the women's common room or if actually it's better to have it downstairs where you've got more space. And just, yeah, it would be great if general volunteers could help out as a salon manager to help the salons run smoothly. Next slide, please. So we've got a huge number of trips for Hyde Park. We've got the football tournament on the 28th, as per usual. We've also got some football sessions, so guests can train. That's going to be at Little Venice Sports Centre. We've sorted out all the transport for that. There's also kind of Arsenal Stadium tour, QPR football match, museums and theatre trips. And we also have a women's only trip to watch The Lion King at the Lyceum Theatre. All the logistics have been sorted for that and everything is on Wikimus. There's a kind of separate page for each trip. So please do have a look if you're concerned or want to know any of the details. Next slide, please. And I'm going to pass over to Anna.
I was going to say, it's like, you're going to go on about badges? Hi. These are the badges that we've got this year. There's a couple of newbies and a couple of differences. So yeah, you won't need to worry too much about the kitchen ones. As Jess was saying, your meals are prepared in-house by the hotel staff. But we've got a new guest welfare one, if you can see the one with the heart and the hand. So that's one in addition to the badge with the name on it. That's just to help identify who is part of the guest welfare team. And we've also got a new pronouns badge. That's the bottom left underneath there. So that's optional. We'll be providing some support information to go on the gates where volunteers come in, so then they can find out a bit more about why we're asking for them and how to use them properly. But yeah, totally optional. So that's it. Otherwise, I don't think there's... Oh no, there is one more. We have got a services organizer and guest welfare organizer badge, which is the red rim with the red dot. Sorry, orange rim, red dot. Which is just to identify that that's the sort of person who's organizing the gig. So that's what that is. Ta-da! There's a big picture of a car. This is roughly what your centre vehicle is going to look like. And for those of you who are going to be starting on the afternoon shift on Sunday, so first up, your shift office pack is going to be in this car. So your first mission to get all of the goodies like radios, petty cash, wristbands, badges, is that's going to be in your car. So the information about where the vehicle will be parked exactly is on Wikimus, and the keys will be with hotel reception. It will be nearby. It's not going to be far away. But yeah, so first step is to go and get all the lovely orange crates because they'll have all the important stuff so you can get cracking. So that will be there for you Sunday. So I updated on clothing in our previous briefing, but if I haven't had a chance to update you yet, we've changed how we're providing clothing this year. It's now uniform across all of our centres. Based on volunteer feedback, we've just created a system. There's going to be guidebooks, there's going to be a laptop for general volunteers to use just to help keep track of clothing. What we said that we'd share at this point is what we're calling a RAG rating, so a red, amber, green rating for how we're doing in terms of stock across the entire the entirety of Crisis at Christmas, so warehouse and all the centres. So this isn't relevant to just what's in your centre, you can keep tabs on that, but this is what it looks like across the whole project. Meaning that if, for example, you wanted to ask for more gloves, you might get more gloves from the warehouse. We might have some, but not a lot. If you wanted to ask for more men's socks, we've got loads. You can give those out like with reckless aplomb. We've got so much of them. But the things that are in red, that's what we're short on. So typically speaking, the things that are in red, you're going to get 100% of what we've got. So once you're out in the centre, we're out. So the reason that we said that we'd share this with you in advance is if you wanted to take this list and let your volunteers know, either now or at the debrief at the end of a shift and say if you're coming back for another shift and you happen to have any of the items in red, we'd welcome them. So the items in red are the ones that if you want to target and share specifically with your volunteer teams, that's the ones we want. Less worried about the tracksuits. Those are something that we resource in and we get in at a 1-to-1 ratio, the idea being for the first night. So you'll end up with tracksuits, underwear and socks, so then you can give those out as people arrive. So that's like an on arrival treat, so then people can jump in the shower and have a completely fresh outfit and start feeling really cozy and toasty in their hotel rooms. Yeah, so that's what our rag rating looks like. This will also be available on you'll be able to find it on Teams as well, so you can print off a better version than this, but this is what we said we'd give you a heads up about at this point. Can I have the next slide, please, Maz? Oh no, that's you. Can I nominate Maz, please?
Wait, no. Hi, sorry, I'm running the slides, so I forget they're my slides too. So I'm just talking about laundry. It's basically the same as what we had last year with I Hate Ironing. We're partnering with them for laundry this year. The only thing that's really changing is how we track the guest laundry. We've developed a new tracker in place that will be connected to their wristband and room number. So if, for example, their room number gets moved off of their bag, we'll at least know that it's connected to that wristband as well, if that makes sense. And just one key thing to note for this year's laundry, on the first collection day, which is the 23rd, our laundry partners will actually be coming to site at Hyde Park as well. That will be the first collection, and normally we have a 48-hour turnover for laundry, but because of the way the dates fall, first collection will be on the 23rd, and it will be closed till the 27th. So if you do have guests asking for their laundry to be picked up on the 23rd, please do let them know that they won't be returned till the 27th. Obviously, if they don't have enough clothes or something, we have our laundry service available, but just let them know just in case they don't have enough. Besides that, same. So we can go to the next person. Ooh, yes. Tim?
It is me. Hello. Hi. So once again, I am here to talk a little bit about IT. So crisis of crisis accounts, this is I think the 4th year we've had those. So I hope everybody is familiar with what they are for now. But for any of the new starters, especially if you are a new key volunteer, welcome. We have got crisis of crisis accounts, which is a Microsoft thing, which allows access to our internal Microsoft team. So you can check to other volunteers. It allows you access to Wikimus, which is our internal wiki for you to search about our information, and a bunch more goodies. I'm not going to go through here, but please do get your account set up now before your first shift. The activation emails have all been sent out. Resource coordinators, your account details have been sent out yesterday. I think I missed some people, but it should all be sent out. But if you have not received yours, please contact IT support, which is at the bottom of the screen. Do you practice getting into your account and trying to navigate through some of the systems so that you are more prepared on the day? And also give incognito and private browsing mode a try so that you know that when you are at the center, you're at a computer, you can log in correctly. The later you leave it, the less likely IT support, which is my team, can get to you, as many people will be trying to get into the system at the same time as you. So please do make sure that you give yourself a little bit of time to get everything set up. And one reminder is that you will need your mobile phone on your person to do MFA. So it's an extra security measure just to make sure that we prevent unauthorized access to our systems because we've got a lot of sensitive information. We've got IT support going already, so you can see a link on the screen as well. But to repeat, we've got IT support this week from 10 a.m. to 6 p.m. on the phone, and you can always email us as well. More details will be in that link. Next one, please. Next slide, please. Cool. Hi, Wikimus. Yeah, perfect. Thank you. Wikimus. So this is our internal IT system. Internal system for looking up information, and I'll just type in the link in the chat again. Okay. This is where we store all of our information, and the services team have been especially hard at work this year, putting everything that they know into the system. So everything from activities, services schedules, signposting, food bank, logins, everything that you can think of, they've all tried to put it into Wikimis. The reason we do this is because it has a search function which works really well, and so you're not going through like 50 Excel sheets just to find the information that you need. So to get to Wikimis, you can go to wiki.crisis.christmas, or you can go to crisis.christmas 2024's team in Microsoft Teams, so you can see it on the screenshot. We've got the general channel, and then in the general channel, you've got Wikimis, and you can also pop it out into a separate window if you like, using the arrow that is shown on the screenshot as well. We've got tons of information and video demos as well, so be sure to check it out in your spare time, hopefully before your first shift, just to have a little feeler on what it looks like and where you can find information. Cool. Next one, please. And this year, we're also trialing something new. So guests and especially general volunteers that don't have crisis.christmas accounts, we have prepared a center page, which is kind of a public homepage for the center itself, so that they can also see a limited subset of the information that we put out with Wikimis. The link for Hyde Park is on the screen, hydepark.crisis.christmas. And if you need to send information about day centers, then you can also use crisis.christmas. And of course, the day center invite on crisis.org.uk also works well. And everything in these center pages can be shared publicly. You can copy the link and then share it with people. It doesn't have anything sensitive like hotel addresses in it. So do not worry, you can share those around and be sure to spread the word. It is great for information on the food and services and what is on each day, local services, house rules, feedback forms, and policies and procedures. We'd love to know what you think about these center pages, whether it's helping you or not, and how we can improve it for next year. So be sure to give it a spin and let us know what you think afterwards. Okay, next one. Cool. That one is Amanda, I believe.
Thank you, Tim. Okay, you'll be really pleased to hear that we're nearly at the end. Thank you for bearing with us. This is just a sort of a quick reminder, shout out from Gallo Glass, just to remember to invite someone to the security team to your shift briefings, handovers, etc. They're a super invaluable source of guest info, so please include them and make use of them. Your briefing checklist templates will be in your shift office packs. I believe they're going to be laminated this year. You don't need to complete one every time and sign it off. Just make sure you've covered all the points. Don't forget to debrief at the end as well. This is a shameless plug. We've still got hotel assistant spaces in January in Hyde Park and Aldgate. So please give us a shout out to fill those. Last thing, look after yourselves, look after each other. Most important thing we've got are our volunteers to look after our guests, make everything work. So make sure you're taking care of yourselves. Next slide has the volunteer wellbeing program. If you do need to call or text at any time, the numbers are on the bottom there. They're pretty much everywhere. They're on Wikimis. They're going to be on posters in the centres as well. So do make use of those. And I think that concludes the content of the meeting. I think most questions on the chat have been asked and answered. If anybody's got anything quick, really burning, speak now. Emma?
It's burning. I'm not going to say it's going to be quick though, Amanda. Sorry. Couple of points. For check-in, can I just check that the iPads for check-in are going to be in that big orange box?
Tim, do you know about the iPads?
Katie, I think they should be in the shift office patch to be ready to ship out. But Katie, could you confirm or deny?
Katie's dropped off the call. We're still in the process of confirming final
Sure.
details with the providers.
Okay, because the sooner we can get them, the better. That would be.
I can jump in on this. I've been having a back and forth with our IT team because I would have loved them to be sent to the warehouse for us to bring. They are going direct to all of the hotels. They should be there at 9 a.m. And the IT team that we're using this year, called Storm, are setting them all up, connecting them to the Wi-Fi, and going from there. I would bloody love to say with no hesitation of doubt that they will be there and set up by 10 a.m. But until I've seen them, I always have doubts. So, but yeah, me and Amanda are going to be coming down from about 2-ish, maybe 2-3-ish. So if they're not there, we'll work out a contingency for you.
Okay. Sorry, I've got a few
I
more.
would just say the shift doesn't start till 3:15, Johnny, so don't get there too early.
Get there early, Johnny. We'll be there. And then the other question was what? And they're at 3:15. I think last year, we started checking guests in at about 4:30, I want to say. And then that then comes with a follow-up question about dinner time, about what you guys have agreed with the hotel, because that was carnage last year.
I'll leave dinner time to Jess, but we've said 6 p.m. to guests. So we'll check people in from about 6 p.m. onwards. And yeah, but look, if there's a massive queue outside and everyone's ready, we're good to go at 5. Like, that's fine by me as well. But yeah, so guests are expecting 6 p.m. I don't know if Jess is still here. Do you know what we wicked?
So I can't remember the exact time, but it's after 6 o'clock and it's on a rolling basis. And I think it was sort of soup and bread because that's an easy thing to do on a rolling basis rather than having one hot cooked meal out at once. What was the carnage last year? Is there anything you want me to speak to the hotel about before Sunday?
It was check-in and dinner all at the same time. It was just so you've been to the hotel, Jess, yeah?
Yeah.
Okay, so the check-in desks are in the cafe area at the top, and then the porterage service, which is where the vols take the guests up to the rooms, is the area on the at the bottom of those steps. So they go up one side, check in, down the other side. So that whole area to access the restaurant can be blocked by the check-in process. So I don't know what the solution is.
Yeah,
I
I can chat to the
6 o'clock
hotel
check-in
about
and
it.
6 o'clock dinner didn't work.
Yeah, but it's tricky because then if guests arrive at 7, like at some point they'll have to be dinner at dinner time, and once guests get into the hotels, they probably will be wanting a hot cooked meal. But maybe there's something to do with layout. Maybe I can speak to the hotel if they have an alternative way they can serve for that first night, just to sort of ease the pressure in the rest of the space. I'll pick it up with them tomorrow, Emma. Thank you.
Awesome, thank you. Oh, sorry, one more on that. With dinner, you mentioned that you want that early women's access point. I'm assuming that that's not applicable for day one.
Yeah, correct. So that wouldn't be applicable for day one because the guests would still be arriving. So that'd be from the 23rd onwards. And it's just optional, and it's sort of for you to run and see if there's a feel for it basically on the women's floor. But we think it's a nice touch.
Yeah, awesome. Thank you.
Jen?
Just a quick one. I put it in the chat, but I don't think Katie saw it. We talked quite a lot about giving guests the opportunity to tell us if they're leaving, because with the welfare check system, we spend a lot of time searching for guests who've left the hotel for a couple of days. And we talked about adding to the sign-in to ask them to tell us if they're leaving for more than 24 hours and leaving them a little slip in their room to leave at reception saying they'll be off-site for a certain amount of time, which would really streamline our welfare check system. So if we can do that, that will be really helpful. Thank you.
I'll add it to the list that you need to say at check-in. I'm sure we can make a slip or something. We've got little appointment cards
Yeah, I mean, it could just be a bit of paper, but if they can drop it at reception and just saying, I'll be gone from this date to this date. We just spent so much time chasing people that were off site last year.
No, it's a good point. I'll add it to like the kind of mini induction checklist.
Thanks,
then.
Katie.
Great. Any more before we
just a quick one, Amanda. If you're going to have slips for guests to leave, then you need to have a contingency if they can't read, write, or speak English.
Thank you. We will note that, Jenna. Next slide. I think it just says breakout rooms. Yes, brilliant. So after last night's carnage of breakout rooms, we're trying a new approach. Hope you've all managed to locate the second link for your shift. It's week 1 mornings, week 2 mornings, week 1 afternoons, week 2 afternoons, and then nights we put you together because you're a small and beautiful team. Those meetings are yours. You should be able to get into them. You should be able to stay in them for as long as you would like to now. Sorry we're overrunning, but I think it was worth the extra bit of time for this. I will say goodbye and I'll see you on Sunday.
Thank you.